came out which showed that in murine models of focal cerebral ischemia, the use of resveratrol reduced the infarct size. It also prevents the diabetes-induced impairment of enos dependent vasorelaxation, thereby leading to better cerebral perfusion. Now, looking at myocardial ischemia, it is again shown that it can protect against myocardial ischemia by inhibiting platelet aggregation, the preconditioning the muscle tissues to issue ischemia reperfusion, and potentially regenerating tissues in the infarcted region. Now, the ability of resveratrol to protect the heart from ischemia when administered prior to the ischemic episode is well established. When you use it before the onset of myocardial ischemia, the damage to the myocardium is limited. Some of the proposed mechanisms, as I said, are the same thing, and we also have that it can reduce the size of the myocardial infarct. Now, it has also been investigated in a few clinical trials where the combination of resveratrol, calcium fructoborate were improving the markers in peripheral blood in patients with stable angina pectoris, and it also improved the diastolic function when compared to the systolic function. Again, the same similar pathways of the oxidative stress where it inhibits the reactive oxygen species, the endothelial nitric oxide synthetase and the vascular endothelial growth factors all contribute to this protective effect in myocardial ischemia. Now, looking at the role of resveratrol in diabetes, we all know that there is an increased oxidative stress among diabetics, and the beta cell dysfunction is closely related to that. And the pancreatic defenses against these the beta cell defense against these oxidative stress is weakened in patients with diabetes, thereby protecting the beta cells against this oxidative stress makes important role in the treatment of diabetes. Now, looking at really closer to the molecular basis, this sirtuins 1 to 7, especially SIRT1, which is a important pathway for the NAD dependent lysine deacylase. Now, when it used at low doses, it indirectly influences it, and at higher doses, it directly inhibits this, activates this pathway, and it modifies the adipokine expression due to the inhibition of the inflammatory response. Thereby, it reduces the insulin resistance. It also restores the endogenous antioxidant manganese superoxide dismutase function independent of the sirtuinin activation. It also happens to lower the insulin resistance to the inhibition of the nuclear factor kappa and the activation of the peroxisome proliferator activated receptor gamma. Now, special look at diabetic cardiomyopathy. We all know that diabetes is an independent risk factor for heart failure, and the term diabetic cardiomyopathy has been introduced to describe the decline in cardiac function secondary to diabetes. It is usually associated with early diastolic dysfunction and late systolic dysfunction. And when you microscopically examine the heart tissue in such patients, you find there is increased interstitial fibrosis and cardiomyocyte hypertrophy. And biochemically, if you examine the tissue, you find there is increased oxidative stress, increased apoptosis, and abnormal cardiac energy metabolism. Since resveratrol has been shown to possess anti-hypertrophic, anti-apoptotic, and antioxidant properties in cardiac myocytes, it may target several pathophysiological events implicated in the pathogenesis of cardiomyopathy. And the last topic of the choice is about chemotherapy-induced cardiotoxicity. We all know that a lot of agents like doxorubicin, sunitinib, cisplatin, and trastuzumab, which can cause cardiomyopathy, chemotherapy-induced cardiac toxicity. And this resveratrol has a protective effect against these chemotherapy-induced cardiotoxicity because of the ability to counteract the reactive oxygen species produced by these. In addition, resveratrol has also been shown to protect against doxorubicin-induced cardiomyopathy through activation of the AMK inhibition of the P70SK mediated autophagy and activation of SIRT1. It is also shown that resveratrol can protect against doxorubicin-induced cardiac toxicity by increasing the expression of SERCA2A, mitochondrial electron transport chain complexes, mitofusin 1 and mitofusin 2. So, if you look at this drug, we also have the question is the safety and tolerability of this drug. It is usually well tolerated in both young and older humans. No major serious adverse events were noted in the subjects of doses up to 5 grams per day, and even at higher doses, no toxicities or adverse events have been reported. The lack of adverse events usually make it a safer data, and most of these can be graded as minor adverse events according to the CTA-CAE criteria. So, conclusions: resveratrol is a natural compound which demonstrates well described anti-inflammatory, anti-oxidative, cardioprotective and analgesic properties. It is a molecule with low toxicity that targets multiple molecular signaling pathways and consequently affects numerous carcinogenesis related genes. It has been shown to be effective in modulating blood glucose levels, decreasing insulin resistance, inhibiting chronic inflammation, improving blood lipid profiles, attenuating diabetic hypertension, and counteracting oxidative stress. It can also play a role in the prevention or retardation of diabetes related comorbidities and complications. So, the take home message is, taking into account the beneficial effects of resveratrol on hypertension, obesity, inflammation, diabetes, and dyslipidemia, resveratrol could constitute an interesting pharmacological approach for the treatment of metabolic syndrome, which is associated with an increased risk of CVD development. Thank you. Thank you all.
Thank you, Dr. Prasanna, for highlighting about a new molecule. Actually, this molecule was there earlier also. One of the Indian pharmaceutical company was marketing it maybe about a decade back, but then it wasn't there. But if you look carefully, just like how we prescribe polypill for diabetes with putting a ACE inhibitor, metformin, statin and all that, this looks like as a polyphasic pill. In one pill you have multiple effects. You say it prevents diabetes, hypertension, its complications, and also analgesic effect. Looks like a promising drug, but we don't know how the guidelines have been as far as. Now to the audience, if anybody wants to ask, I can see Dr. Ilango. Dr. Ilango is a clinical pharmacologist and professor of pharmacology. Would you like to highlight anything?
I think the role should be as an add-on therapy to our armamentarium rather than a standalone approach. I think as an add-on therapy, it should be potentially explored. Thank you all.
There are no much questions. I think we can go on to the second talk.
Thank you so much, sir, for your wonderful talk. Our next speaker is Dr. Shahid A. Merchant, sir, MD, DM and DNB, Consultant Interventional Cardiologist, Mumbai, and 1978 Gold Medalist, MD, DM, DNB Lecturer, and alumni from prestigious GS Medical College and Chem Hospital, Mumbai. And he'll be